Hey folks, Cesar Perez here. Today I wanted to take a minute and talk about cutting the cost of surgery. For many people that have either high deductible health plans or anybody who's just wanting to pay cash, I wanted to shed some light on this topic because generally when you think about it, if there's a procedure that you need to do, generally the first thing you're going to want to do is look for pricing. Unfortunately, if you're trying to go to the hospital, a doctor's office, specialist, it's very difficult for them to give you a set price. They're always going to say, well, it depends on your insurance. If you don't have insurance, what'll generally happen is they won't really give you a price. No one can give you a price. They're going to say, oh, well, I'm sorry, you just have to do the procedure and then get the bills afterward. Of course, when you're doing a procedure, if it's going to be at a hospital setting, if it's not going to be outside as an outpatient, if it's going to be as an inpatient in a hospital, you're probably going to have a lot of bills coming in. You might have the anesthesiologist, you might have the surgeon, you might have the equipment use of the hospital, nurses, all of those costs. And so that is really what scares people. I know in the area where I live, a lot of people go across the border, even though it's it's not too far away, but across the border, what happens is people can actually get a price, and so they know exactly how much they're gonna pay. I know people who pay $3,000, $4,000, $5,000 for surgery. It just depends on what it is, but what they like is the fact that they can get a price, and so a lot of these people don't know what else to do besides just run across the border. It's not too far. They go, they get their procedure done, and then they come back. Of course, it might be better to get it done here, but unfortunately, it's kind of hard to get a price. I'm going to share with you one of the places where you can actually get a price. There's actually a few places like this across the U.S., but you got the Oklahoma Surgery Center. So even if you are in another state, one of the beautiful things about the Oklahoma Surgery Center is that you can call them up, actually have a conversation. If you've had tests done by your doctor, you can fax them to the doctor there and they'll talk to you on the phone. And they strictly will only accept cash. I do believe they may fill out paperwork in case you're going to get reimbursed by your insurance company if you have some sort of plan that works on a reimbursement basis or that's a self-insured plan. Usually they may reimburse you. But the beautiful thing about the Oklahoma Surgery Center is that you can actually get a price over the phone. Their prices are posted online, so you can go online to their website and actually find exactly how much you're going to pay. So even if you're in another state, for example, the price of inguinal hernia is, if you go to their website right now, it's $3,060. And so that's all inclusive. You won't get any other bills from them. You're going to get that bill, you're going to pay that amount, and that's all you're going to pay. You're not going to pay any more, no surprises. Unlike when you go to the hospital, you have no idea what in the world you're going to pay. When you go there, you're only going to pay that for your inguinal hernia repair, and that's it. Another example, I believe their rotator cuff, shoulder rotator cuff, they fixed that. I believe that's $6,149. And so if you do have a high deductible health plan, that's approximately what you would pay. You would actually pay a little bit more because generally the high deductible plans right now, they range between $6,500 and $7,500. But the beauty about this is that there are no prior authorizations. So you don't, if you don't have insurance, or if you have a high deductible health plan, you're trying to get a hernia surgery, if you just rather would pay cash, you're not going to have to wait around. No waiting around. They can actually get you in and out. You call them up, you schedule your appointment, you're going to be in and out that same day. And so that's one of the beautiful things when you don't have to deal with any of the bureaucracy. When you do have to go through insurance, what ends up happening is it takes more time just because they do have to approve the procedure, and they generally look at the records and they're having just what procedure you're going to get and all the paperwork. They got to make sure that the doctor coded everything correctly. If your doctor forgot a dot or didn't cross a T, then guess what? The procedure gets denied, and you're there having to get it pre-authorized most of the time. Even on PPO plans, that does tend to happen as well. It's a lot less common, but it does happen. So I just wanted to share this with you. I'll post the link down below for the Oklahoma Surgery Center. I do not work for the Oklahoma Surgery Center. There are also other surgery centers across the U.S. I know we have one here in California, and then there's a few more across the country. So you can check all of those out. And if you're trying to get a procedure done, maybe you don't have insurance, maybe you have a high deductible health plan and you want to get things done quickly, you don't want to wait around for a month and a half, if time is of the essence, talk to these guys. They might be able to help you. Thanks for watching.